There's been a little change recently. Going to the pet aisle, you'd see flea collars for your dogs and flea collars for your cats. And now there's no such thing as flea collars for the cats. There's some type of a recommendation. They felt that with a collar, that the full body of the cat wasn't necessarily benefiting from those chemicals and thinking maybe the cats don't need to be exposed to these chemicals. What is the real long-term effect of being more exposed to fleas and ticks?
This area has been deemed a Lyme disease hotspot, a tick
Oh,
hotspot. The ticks can also bite you as well. So there's zoonotic diseases that can be spread by fleas and ticks.
hmm.
So not only for your pet's health, but for your own health, you should be keeping up on these products.
We've heard about people who do have exotic pets. I think some years ago, some big story about somebody who I think they were just even visiting the airport. I don't think they were traveling. And they had some type of a monkey. And then it was just like, nope, stop. And their pet was confiscated right there, in their little jacket and diaper and everything. And that was that.
These type of pets are illegal in Canada, so it's not even in our grasp to own one of these animals.
Welcome to CooLife Podcast, brought to you by therealthingdating.com. www.therealthingdating.com.
Polydor Records for out scouting. This girl grabbed my bangs and ran my head right into the speaker.
Oh,
And everyone here like this, yeah.
When we shot the scene in Good Will Hunting, I didn't know who most of these people were at the time. I mean, they weren't stars. It was Gus Van Sant that directed it. Gus Van Sant was on the floor with Matt
Will
Damon's
Hunting.
character. I didn't even know who Matt Damon was at that time.
I'm Eva John. I'm a former candidate for local government. I was a children's television entertainer, and I love this world, and I believe we should take care of each other and have a lot of fun along the way. Welcome to CooLife. Here we go. And welcome to CooLife Podcast. I'm Eva John, and today we are continuing part 2 of my conversation with Dawn Drake, veterinary technician. Dawn, welcome. Welcome back.
Thank you.
I'm so glad that we're able to continue this very interesting conversation about veterinary care and pets. There are so many of us, a large part of the population, who have pets, dogs and cats and birds and all kinds of other things. And, you know, I realize over time, taking care of my pet, that it can be a high value investment, having a pet and giving them proper care. Like some veterinary care can be so expensive, even like a tooth extraction, depending, we're talking about over $1,000 before any other, supporting medications. Is there assistance available for pet owners who are not necessarily able to afford some types of pet care?
Well, we particularly, the Royal Vet Hospital, we work with a company that finances veterinary care for the patient who cannot afford to put out the money up front. They offer 3 months of deferred payments and then low monthly payments in order so that you can afford those surgeries up front and your pet doesn't have to wait and potentially risk more health issues.
That's great, I guess, if they are able to do financing pretty much the same as if you're getting a car or some other big ticket item. So that is an option because it does creep up some of those costs.
Absolutely. And we encourage people from the time that they come in with puppies and kittens to consider pet insurance. Pet insurance can plan for those big ticket items, accidents, plan for senior pets with health issues. Um, Pet insurance can even include routine dental care. So, routine dental care is so important to maintain the overall health of your pet. So, if you start doing dental maintenance as they're young. Hopefully, we don't have to get into those operations where it costs thousands of dollars for extracting multiple teeth. We can take care of the teeth from the time they're a puppy, which is routine maintenance, routine cleanings, routine vet visits.
That's kind of, I think, a better way to go as far as being able to take long-term care of your pet the way you would yourself. Now, there are times when a pet's life cannot be saved if they are severely ill. What do you say to a pet owner who doesn't want to euthanize a severely ill pet?
We, at the end of the day, will support the owner's decision no matter what route they want to go. We will offer palliative care for the animal so the animal isn't in pain at the last days of their life. We will offer information, support hotlines, numbers that they can call to make educated decisions for themselves as well as for the well-being of their pets. But we will support them along their journey and give them education so that they can make the best decision for themselves.
Now, in the end, because ultimately it is the decision of the pet owner, have you encountered a pet owner that's made a decision that they want their pet euthanized, even though you can see a clear path to that pet's survival or even thriving and going on to live good life, but the pet owner doesn't want to go that direction?
Absolutely. Unfortunately, this does happen. We call it convenience euthanasias. That's why we make we have to do an exam prior to just jumping into the euthanasia. We either need to have a relationship with the client, being a long-term client, and knowing the pet's medical history. But if somebody just calls up, makes an appointment, and wants to euthanize their pet, it's just not that simple.
Okay.
We need to do an exam to make sure that they are a candidate for euthanasia, that there is some medical reason that they need to be euthanized. We don't just euthanize pets because they're peeing in the house or because the owner doesn't have time for them. We won't do something like that. That's just not ethical.
Now, would you make the decision to say, okay, we're going to take this pet off your hands. We're not going to euthanize them, but we'll give them care till they can be in another home? Or can you just not step in that way?
Unfortunately, we're limited by the laws, right? If a pet owner does not want to leave their pet with somebody else, we can't physically make them do that. We just hope that every veterinarian out there is like us, that requires a physical exam before they just jump in to euthanizing. We hope that every veterinary hospital out there has the same ethics that we do when being approached for euthanizing a pet that they don't know.
Okay. We would hope, right?
We would hope. There are like services, like if we can't particularly help a person that, wants to euthanize their pet because they can't take care of it, like I will go out of my way to help them find like a rescue, a place where they can surrender their animal. We will give them information on steps to take in order for them to have different venues, that euthanasia isn't just the only thing that's going to help solve their issue.
Okay.
But there are rescues, there are SPCAs, there are other places that you can, fosters will take your pet until they can find a home for them. There are other venues. And there was a particular instance where we had a case that was actually a client at work, and she had to get rid of her pet, and it was a large breed dog, and she was facing euthanasia if she couldn't find a rescue or a home. So
Wow.
we worked with her. I actually had my co-op students like contacting rescues daily for weeks to try to help this person find a home for this dog. So that wasn't the only option. So we won't just stop at, saying no. We would actually try to help them resolve the situation as well, for sure.
Right. That's wonderful. Well, I'm actually going to incorporate the decision again. These decisions lay in the hands of a pet owner. Now, what happens when you've got a pet owner who feels like, their pet's doing great, they're feeding them well, they take them on walks and so on, and, decide that veterinary care and, the high price tag that goes along with it is not for them. And they don't bring their pets in 10 years, 12 years, or their dog or their cat or their budgie bird. And then more than a decade later, they come in. What kinds of problems do you see build up over that kind of a time period where a pet just hasn't had any veterinary care?
I know we had touched on it before, but a large thing that affects animals that people don't realize is proper dental care. If a pet hasn't had any dental care or maintenance in 10 to 12 years of their life, and they come in with massive dental disease. Dental disease, just like people, can affect their heart, their liver, and their kidneys. So it might not be the dental disease that kills them, but it might be a secondary condition caused by the dental disease when the infection gets into the bloodstream and affects their internal organs.
Okay.
Yeah. Routine things can be detected yearly. Things like bladder infections, skin infections, chronic ear infections, things that cause the animal pain, because not only do we want them to have a quality of life, but we do want them to have a long life as well, a long pain-free life.
Now, there's been a little change recently. Well, in recent years anyway, where going to the pet aisle, you'd see flea collars for your dogs and flea collars for your cats. And now there's no such thing as flea collars for the cats. There's some type of a recommendation. They felt that with a collar, that the full body of the cat wasn't necessarily benefiting from those chemicals, and thinking maybe the cats don't need to be exposed to these chemicals. But even for an indoor cat, let alone for people whose cats are roaming, and there's lots of people whose cats just roam and come in for dinner, then what happens when they've got these other types of, there's some collars you can find here and there that don't have the same ingredients that they once had. What is the real long-term effect of, being, more exposed to fleas and ticks?
Well, especially in this area has been deemed a Lyme disease hotspot, a tick hotspot. So, your pet's bringing ticks into your house. The ticks can also bite you as well. So there's zoonotic diseases that can be spread by fleas and ticks. So not only for your pet's health, but for your own health, you should be keeping up on these products to protect them as well as yourself.
Well, it's not sounding like such a great decision to take these collars off the market. Then what are the actual substitutes? And dogs' flea collars are still out there, so I don't know if it's just a matter of time before those are going to be gone. But for cats, the fleas and ticks.
And I think it is a matter of time before they're off the shelves as well, because like you said, they're just not finding that they're effective. They might be effective around this area, but they're not effective on the body of the pet, on the rear end of the pet. If the fleas are hanging out here, yeah, it might be effective. But there's also other ramifications of cats chewing on these collars, trying to get them out, and then that causing health issues by them chewing on these collars. There's also concerns of children. If you've had a baby and a cat with a flea collar on, or a dog with a flea collar on, and you have a baby in the house, even a toddler walking around, what's the first thing a toddler wants to do is put things in their mouth. So you don't want those chemicals to be accessed to your family, to your children, to other pets to be able to chew on them. It's just not safe, the chemicals to be ingested.
Of course not. But I don't think there's a mother around who wants to find out their children have Lyme disease because their cats are no longer protected the same way they were. That's just not an option. We're going to find families who are not going to want to have cats anymore. But what are the alternative ways of protecting a cat now that the standard flea collars we all used to know are not really available anymore?
So there's topical solutions. The best products are going to come from your veterinarian because they are dosed properly at your veterinarian. They're done by weight correctly at your veterinarian. And there's research behind all the products that are being sold by a veterinarian hospital. These aren't just off the shelf, over the counter products that people might not use correctly, might not dose correctly, and might not be effective.
Right.
So your best product is to get when you go for your yearly routine visit for your vaccines is to get your flea and tick products from your vet hospital.
Okay.
So there is actually one product we can go back and touch on. It's called Advantage. Those are drops that you can get in the pet stores. The only thing, like I had previously mentioned, is sometimes people don't dose them correctly.
Mm-hmm.
They don't use them correctly, so they're not effective.
Right.
Only the medication's only as effective as the person that is using it.
Of course.
So if it's dosed underdose, it's not going to work. If it's overdosed, it can be dangerous. So there are those products at the pet store, but you know, us as a hospital, we don't encourage over-the-counter products because of the safety of people dosing their own pets.
And I mean, really, I think for the ordinary person, that might be going right out the window because you really don't get those topical products in just the regular stores anymore. So, I mean, if it's going to come along with veterinary care exclusively, instead of just like, every few months getting a collar or every few months putting those drops, I think it's really changing the relationship and the future of pet ownership for cats anyway. Fingers crossed, we'll see what happens with dogs. Right now, we're going to take a break to talk about our sponsors and supporters. First, we're going to have a look at viewer mail. Reminder that please send in your comments to info@CooLifeWorld.com. That's info, I-N-F-O, @CooLifeWorld.com. And now we're taking a break to talk about our sponsors and supporters. We'll be back with more pet care talk with Dawn Drake, Veterinary Technician on CooLife Podcast. Those lonely days of lockdowns and isolation are gone for good. Go to www.therealthingdating.com. That's www.therealthingdating.com. It's time to share. Share your time, share your life, share your love. www.therealthingdating.com. Join for free. Upgrade at any time, starting at just $5.99 a month. www.therealthingdating.com. Because it's time. You're listening to the CooLife Podcast. We'll be back in 3, 2, 1. And we are back on CooLife Podcast. I'm Eva John, and we are having our conversation with Dawn Drake, Veterinary Technician. Dawn, I wonder, we were talking about some of the, sad and difficult things that a pet owner might need to face if a pet is severely ill. Now, for a pet owner who has lost their pet has passed away, is there any referral to a kind of grief counseling specific to what a pet owner would go through?
Absolutely. Our clinic provides reading material pre-euthanasia as well as post-euthanasia. These reading materials offer grief counseling hotlines that you can call. One is through the OVC, which is the Ontario Veterinary College, and the other is through Gateway Services, which is our crematorium that we use throughout Ontario. They both have great resources for counseling, as well as through your own doctor. You can always request grief counseling through private resources as well.
That's wonderful. It's an important, necessary support, not to be alone with some of those profound feelings after the end of such a special relationship with a
Absolutely.
pet. Now, can you tell me, normally we know that the most popular pets are dogs and cats and, different types of birds. Who doesn't love birds? And can you tell me, are there some more unusual pets that you've seen come into your veterinary hospital for care?
Absolutely. We had this very large monitor come in that unfortunately had to have its tail amputated.
Oh my goodness.
But
And just
it
for
was
those who don't know, a monitor is a big, gorgeous
lizard,
lizard, ladies and gentlemen. Who guessed
reptile.
lizard? Who guessed lizard? Who didn't? And so, wow. So you had this gorgeous monitor come in,
Absolutely.
and their
Yeah.
tail it's all about their balance and moving around, isn't it?
Yeah, but post care, keeping in contact with the client, it did not affect his mobility at all. He did return to normal health, but unfortunately, it was necessary to remove the tail. But he went on to live a very happy life after without his tail.
I'm glad to hear that. Well, have you ever encountered an unusual pet that you had to turn away from your veterinary hospital just because it was just off the scale as to what could be done to help them?
There are some animals that we particularly don't service, but we would do everything in our power in order to refer them to somebody that could help them. I'm talking about snakes. We don't deal with any type of snakes or any type of spiders like tarantulas or something like that. But there are resources out there and other specialists that would deal with something like that. So we would do our best to help refer them to the right people that could help them.
Right, right. Well, if you're a tarantula owner out there, I mean, you've made that decision to cozy up to your tarantula. I'm not judging. Just be prepared to take a few extra miles driving around, finding the right kind of care for your tarantula.
Absolutely.
Not me though. Now, I mean, we've heard about people who do have exotic pets, like, lemurs and rhesus monkeys and baby leopards. And there was like, I think some years ago, some big story about somebody who I think they were just even visiting the airport. I don't think they were traveling. And they had like some type of a simian, some type of a monkey. And then it was just like, nope, stop. And their pet was confiscated right there, in their little jacket and diaper and everything. And that was that. Like, when you see a pet owner with these types of extreme exotic pets, what do you think about that?
Well, first off, these type of pets are illegal in Canada, so it's not even in our grasp to own one of these animals.
Right.
I would hope that if these animals were in captivity, it was for a reason other than just to have them as a pet. Were they abandoned as a baby and needed to be cared for and were unable to be released back into the wilderness? That would be an acceptable reason to own one of these animals, because we just don't want to abandon them if they can't take care of themselves. So there are people out there that would adopt them and care for them for the rest of their life. But to actually take these animals out of the wild, it's pretty unfair for them to have to live a life that they weren't meant to live.
Wow. Well, now what about someone who's finding themselves in that position? They, for whatever reason, do have a rhesus monkey. They went to a fair or something. They didn't realize that they were getting a pet that they shouldn't have, that they can't possibly license or have any type of proper credentials for. What should they do to stay on the up and up within the law? Is there a way they can keep their pet? Like, can they register and just ask for the compassion of the law? Or
I think that would depend province to province. I don't know each province's particular laws.
right.
I know in Ontario, I don't think that would be possible. These animals in Ontario specifically only exist in rescues, zoos, sanctuaries, which is where they should be because the average person doesn't know the nutritional needs of a monkey or anything that we're not familiar with. We're familiar with the animals that we grew up with, dogs, cats, things like that. But the average person isn't going to know what a rhesus monkey eats or the vitamins it needs, the care that it needs. So it's unfair to put them in a position that could harm their health in essence.
Great. Now, what do you say to pet owners who let their pets eat human food?
So I always say that it's fine to feed your pets human food in moderation, as long as it's the right human food. I always caution people that if you do feed human food, they might not want to transition back to dog food when it's convenient for you to give them dog food. So that's always a risk that you run. But human food can be incorporated into their well-balanced dog food. You can feed them, boiled chicken and rice, as long as it's skinless, boneless, anything meat-wise that doesn't have any spices on it. As long as you look for the list of acceptable foods that aren't harmful to dogs, then we can incorporate some of the human foods into our pets' meals as treats, as a little bit something to make them enjoy their food better. But we just don't want you to feed them totally human food, because if you're just eating, let's say, chicken every day, you're not going to have a well-balanced diet. You're not going to have all the nutrients that you need. And I used to make my own dog food back in the day when I did have more time. And that was a mixture of vegetables, meats, but it also included adding some nutritional supplement. At the time, I used something called Hillary's Blend, which was just something that you added to your own homemade dog food, just to ensure that you had that balance of all the nutrients needs that your animal does need.
That's a wonderful option. And I just wonder, can you mention that product again that it was called?
Hillary's Blend.
Okay, thank you.
There's also a cookbook that goes along with that, that provides recipes for you to cook. And some of them are condition specific. Like if your animal has renal failure or a compromised renal system, then there would be diets that you could cook for them that are specific for that particular issue that your pet is experiencing. And then you would add in the Hillary's Blend powder in order to make sure that it has all the proper nutrients.
Now, I know there's some people listening who know full well that they let their dogs and cats jump in and get a little bite, a little taste of their apple pie ice cream. Yes, they do. And a little bite off their hot dog with relish and mustard. And they'll say, oh, for some reason, my dog likes egg salad. Every time I make egg salad sandwich, he needs to lick the bowl. And it's like, but there's salt and there's pepper, and it's like, it can affect their blood pressure the way it does with us. We get diabetes. They can get diabetes. They can end up with some of the human issues. Now,
high cholesterol.
Right. That's a serious condition, right?
Yeah.
So is there a point at which you feel like, okay, buttered popcorn, all that, people let them sneak things from the table. Is that just one of those have more discipline and don't do it? Or can that happen from time to time?
Again, if it's the right food, right? You don't want to be giving them anything with spices, anything that's not on the approved list for a dog to eat. And most of the time, are you just sitting down and eating bland chicken with no spices on it? Or, a lot of our food is processed, right? And because of the difference in the lifespan between humans and animals, it affects them way different and way quicker than it would us as humans, that it could take, decades in order to show up in our health.
I see.
And a lot of things like that, especially around the holidays, can happen. There's been dogs that have jumped up on tables and ran off with whole turkeys. We all know that, cooked poultry bones aren't good for animals, but, it does happen. So You just, especially around the holidays, have to have extra diligence about things like that because, tons of people in the holidays end up in the ER rooms or at the vets with GI issues, diarrhea, vomiting, or really, really sick pets.
Right. Well, I mean, even like you said, poultry bones, because it splinters, unlike certain other types of like beef bones, can get jammed
Correct.
up into their gums, and worse if they swallow it, because of the splintering effect. Is really just like if they're eating splinters of wood. It's no good for them, right?
Correct. Yeah. Yeah.
No, that's a big one. No, thank you. As someone who's really literally from the industry, not just someone's nosy big mouth cousins at the table saying, don't do it. It's like, those are the facts. And I'm glad to be able to present those facts. So many people, they love their pets. They just don't realize that they're doing things that could harm them just by being permissive about something that it's like they feel like, well, he enjoys it. He likes the taste of vanilla ice cream. It's not like there's chocolate in there. It's just vanilla. Like, yeah. But they need to do with ice cream that they need to have a picture of just how much sugar went into it. And it's like, here's a picture of the sugar that's in here that you're about to eat. Because then when you translate that to your pet, having that and how many times that they are in there licking the ice cream, then you can think that.
For sure.
Because they don't have a natural craving for it, do they? For sugar.
And you were dead on about so many pets nowadays are developing diabetes.
Right.
It's crazy, things in kidney disease. Like there's so many pets dying of kidney disease. I lost a dog last year of kidney disease. We lost our clinic cat last year of kidney disease. Another girl there lost her dog of kidney disease. Several patients died of kidney disease. Yeah, it's crazy. And you gotta think, where is all this coming from? And it's the food that we're feeding them, right?
Right. Or allowing them to get into. Yeah.
Exactly. And if you want to cook them like a portion of the turkey that's cooked separately, or cook a small like little Cornish hen and give them a treat, boil it, whatever, with no bones, no skin, then that's something that they can have as a holiday treat. But just to give your turkey that's been seasoned, stuffed with butter and stuffing and onions and all things that are harmful to dogs.
Right.
Onions can cause like vomiting, diarrhea, GI upset. There's so many things out there.
Well, wait a second. Onions can cause vomiting and diarrhea?
Yeah. GI upset. Yeah. There's so many things that we eat that people don't even realize that can be harmful to dogs in general. Mm-hmm. Everybody knows the major ones like chocolate, right?
Chocolate is like life ending for some dogs, isn't it?
Pure cocoa, if you were to give a dog baker's cocoa, they would probably die. Wow. Chocolate it creates GI upset. You would have to eat quite a bit of chocolate in order to die from it, as a chocolate bar, because nowadays there's not much actual chocolate in chocolate bars.
Interesting.
But it does cause GI upset, diarrhea, vomiting, things like that, right?
Well, yeah. Well, good to know. Thank you for that. So you heard it, folks. Stop letting your dogs and cats have the sugar and salt in your snacks and foods, because it's no good for them. And with that, we're taking a break to talk about our sponsors and support. So we'll be back with more Pet Care Talk with Dawn Drake on CooLife Podcast. Those lonely days of lockdowns and isolation are gone for good. Go to www.therealthingdating.com. That's www.therealthingdating.com. It's time to share. Share your time, share your life, share your love. www.therealthingdating.com. Join for free. Upgrade at any time, starting at just $5.99 a month. www.therealthingdating.com. Because it's time.
This is CooLife Podcast. Please remember to subscribe to CooLife on your streaming service and on YouTube as Hellenique Today. That's HELENIQUE Today. Because that helps us to bring more cool stuff to your ears. You're listening to the CooLife Podcast. We'll be right back.
And we are back on CooLife Podcast. I'm Eva John, and I'm continuing my conversation with Dawn Drake, veterinary technician. And Dawn, what do you think has been the most significant contribution to pet care in recent years?
Honestly, there's been so many developments in veterinary care in the recent years. Everything from medications that enhance older pets' lives with arthritis, injectables that help with pain, help make their end of life mobility way better, less painful. We've have injections for allergies now, where pets before used to have to suffer with allergies or take pills every day. There's just so many medications that have come forth in recent history that have improved dogs' quality of life, whether it be with pain, whether it be with mobility issues, just so many advancements over the board. Platelet-rich plasma injections, we do those for dogs. I know people have heard of those for people, but we also do them for animals as well.
Tell me, what is the benefit of a platelet-rich injection?
So what it does is it draws healing to that area. I actually worked at a place years ago that was one of the forefronts in doing that type of procedure. And we did studies on it to go from a pet that had almost zero quality of life, zero mobility, to giving them these platelet-rich injections that stimulate healing, are good for pain relief. And we watched a dog that had pretty much zero quality of life actually start running and jumping and acting like a puppy again.
Wow.
So there's just so many things that are available to make your especially senior pets' lives better.
Right.
Because pets, if we take care of them, they are living longer. We're getting longer with our pets than, say, 30 years ago when we were kids and we had that family dog that didn't have all the things that we do now. That family dog would suffer limping around to the point where we just had to put that dog down, where now we have options in order to extend that life, but not only to extend the life, but to extend it in a quality of life that they're going to enjoy their life pain-free.
Amazing. Well, that's a nice contribution to the experience of pets, and where it really matters, where, as you said, quality of life is enhanced. Now, for the work that you do, for someone who's interested in starting a career, as you have, as a veterinary technician, what kind of training and education is involved?
So, always encourage people before they even think about going to school to be a technician. In high school, you need to have your building blocks of math and science, because there's so many people that get into college and they end up failing out of the course because it is based in math and science. Like I explained before, you're learning everything from radiology to math calculations, to dose calculations, to how to intubate, how to use blood work machines, how to read blood results. There's just so much involved in it. So you have to have a basics in your math and sciences in high school. But then going forward, it's recommended that you volunteer in the industry, because there's nothing worse than getting a year or year and a half, 2 years into the course and then realize that, you know what? I can't put down an animal, or I can't
Mm,
watch an animal suffer in pain.
right.
So we lose a lot of people before they even start their careers
Okay.
because they don't know what they're in for. So once you've had your basis in math and science, you've volunteered to know that, yes, I can be in this business. It is for me, and I can deal with everything that is encompassed in the job in a day. Then I particularly did a year of pre-health and science in college before I did the technician program to get a better basis with my math and science, a better grip of my math and science from high school,
Okay.
which made me successful in my program. Now, in my program, my year particularly, we started with 69 students and we only graduated with 9. So the turnover
Wow.
rate, is
Oh,
very, not a lot of people who start the program finish the program. It's a very highly sought after program. The
right.
numbers start high, but by the second year, the numbers drop off. So you really have to make sure you have all your ducks in a row if you do want to be in this field.
Well, for that kind of solid background that you need in science and math, just to enter it, I would say I hope there's a future where there's even more financial rewards for people in your field. I'm so impressed with the fact that you even took an additional course just to make sure you had that solid background before you hit some of those math and science requirements. That's amazing.
I was going to say that I will admit that since the pandemic, our salaries have increased because of so few people being in the business. And
Mm,
there was such a large demand for people to be in our field during the pandemic.
right.
So they did slightly creep up. Honestly, with everything that we have to deal with in a day, I always say you can walk in there brightest smile at the beginning of the day, but by the end of the day, you could be crying with a client and, sitting beside them with their pet that they're saying goodbye to. So you can run a whole range of emotions in one day, from being happy to being, it's almost like being in a movie with somebody and feeling what they're feeling, sitting beside them, going through it with them.
Well, of course, of course. Well, it really seems that you have a calling for what you do to know what's coming, to be ready for that emotional, roller coaster, the ups and downs that come with it, and to still see and seek the rewards of your industry. Now, with your skills and your background, your education, can those skills be used as a foundation towards becoming a veterinarian?
Absolutely. I've met a few vets that actually took the technician course before taking the veterinarian course. And that's because technicians do a lot of the hands-on work. We are the ones taking the blood. We're the ones, intubating. We're the ones, helping with surgery, doing the x-rays. So a vet who takes a technician course has all those hands-on skills right from the get-go. And then when they go to become a veterinarian, it's just building on the knowledge of those skills.
Now, tell me, Dawn, what would you like to see come into the pet care industry as an enhancement for caring for pets?
Now, what I would love to see happen, and I feel like this would be an enhancement, not necessarily a medical advancement, but it would be an enhancement. I believe that every person in Canada should lobby our politicians to make our vet care tax deductible, or at least a portion of it. They want us to keep up with vaccines. They want us to keep up with the health of our animal, because there
Right.
are a lot of diseases out there that are zoonotic, spread from animal to people. And by keeping our disease control in our animals, it helps keep our diseases controlled in our people. So if the Canadian government wants us to care for our pets, wants us to get the mandatory rabies vaccine, wants us to put this money out of our pocket, I believe every person should be asking their politician to make veterinary care tax deductible to a certain extent.
That's a really good start point for making a change, and hopefully a permanent change to support pet owners. And I love that idea, and I join you in that hope. And so with that, we're coming to the end of part 2 of our conversation with Dawn Drake, veterinary technician. It has been a thrill. Thank you for all of your well-founded information, Dawn. Thank you.
Thank you, Eva.
A real pleasure to have you here. And thank you. Until next time, everybody, I am Eva John for CooLife Podcast. Bye. And that was our show. Thank you for listening to the very end. Please remember to subscribe through your streaming service to get more access to our guest interviews. Also, please subscribe on YouTube to help support our podcast. Until next time, I'm Eva John for CooLife Podcast. Thank you for turning me on.